Well, first of all, thanks for giving me the chance to be here with you and to share this part of the program, especially thanks to Ana Molina, that is the one that invited me here to be here today, but also to the Precis EU initiative for including climate change and health sector decarbonization as a key topic in the agenda. I'm about to share the screen. I am the privileged one to be the responsible for the sustainability strategy here in Spain and for the AstraZeneca Global Hub. Just give me a second to close all these pop-ups. Okay, today I'm going to share with you an approach to the policy strategy at the national level here in Spain, but I am also including how corporates, we can also push forward public-private collaboration in order to make more efficient and to make faster the decarbonization of health sector, but also the adaptation of health sector to climate change. And to do it, I wanted to briefly introduce our company, not in terms of that we are a biopharmaceutical company that delivers medicines and also strengthens healthcare systems in over 125 countries all over the world. But what I wanted to highlight is our sustainability strategy and our commitment that holds on the strong connection that exists between the health of the people, the planet, and the society. And given that the climate change is accelerating non-communicable diseases, and that health sector, we are responsible for up to the 5% of the emissions. Health sector, we have a double responsibility for reducing this impact, but also to strengthen the health systems of health to reduce impact, but also to manage the climate change and especially on vulnerable population. And that's why our sustainability strategy has three main pillars. That is to have a positive impact on climate and nature actions. That means not only reduce our impact, but also to foster nature recovery and biodiversity. And we work also on health equity. And here we focus on those vulnerable populations that right now are especially affected by climate change. And to do it, we work close together with health systems of health to make it more resilient and to be ready for what is coming. With all of this, do it always under the maximum standards of ethics and values, okay? Once said this, because it's important not to set up our approach as a pharmaceutical company, let's move on the why climate health and policy integration matters so much in Spain. As you know, and probably it had been mentioned before, Spain is highly exposed to climate-related health risk. Last year, it was around 22,000 deaths due to air pollutions, but also around 15,000 due to the extreme temperatures. And that makes Spain quite a especially vulnerable country in terms of climate health. And that's one of the reasons why it's so important to push forward policies that supports the health sectors, but also the society as in general to reduce the environmental healthcare, as I said before, it's vulnerable to climate change, but also a very important part of the solutions. And right now, we have worked a lot in terms of energy efficiency, in terms of renewable energies, in terms of turning into better our health sector infrastructures. But the next steps is require a new approach on also adoption and not only mitigation. And we must assure that people affected by climate health has the proper access to healthcare. And that's why it's so important to build this policy framework. And I'm going to start by the Ministry of Ecological Transitions and Demographic Challenge, and how they are pushing forward these policies to encourage the health sector environmental impact reduction. First of all, I want to mention the Spanish position when the sustainability report legislation was reduced. I don't know if you remember, but when the omnibus packages was about to be published, Teresa Rivera and also Spanish government from the Ecological Transition Minister, they were agreed on this simplification of the legislation, but they wanted to keep the carbon footprint report and the carbon footprint transparency. And that's the reason why a couple of months later, there was published one legislation on the carbon footprint registry. This is a legislation that requests companies, but also public institutions, to report their Scope 1 and Scope 2 emissions, and to have a 5 years term plan, reduction plan. And that was something that companies could do in a volunteer basis through the calculation, reduction, and compensation certification that it's called the Triple Impact MITECO certification. But right now, it is not an option. It's mandatory to do this as long as the company meets the criteria for the non-financial report. That it means that it has over 500 employees, or it has over annual budget and expenditure. But what really means is that right now is something that it's compulsory. Companies must report this information, and it is not volunteer anymore, as long as it has that kind of volume of employees and budget. And this is essential because right now it's just Scope 1 and Scope 2, but from 2028 it will be also Scope 3. And Scope 3, it will include also medicines and products, and so it will mean a real change in terms of reporting CO2 emissions. But it is not the only one meaningful legislation that is right now going on. We are also about, as many other countries, not as many other countries at European level, to transpose the Urban Water Waste Treatment Directive. But here in Spain is again very significant because we are not complying the legislation from 2011. So we have to make now a stronger effort to meet the criteria and the request of this new Urban Water Waste Treatment Directive. And at this point, it's essential to find these ways to collaborate between corporates and ministries, but also at regional level, to find common solutions. And I wanted to bring up one initiative that we are carrying out with the Catalan Agency of Water and the Council of Research in Catalonia, but also in Spain, to run a pilot project in how to improve water quality and water efficiency in the Ruby stream through nature-based solutions. This new solution wants to show how wetlands are capable to eliminate micropollutants from the water even more than the water waste treatment plants. So this is so very important to find common solutions, to find the way to achieve this water efficiency, to achieve the EU Urban Water Waste Treatment Directive guidelines, but without being such a burden for regions and such a burden for the cosmetic and pharmaceutical sector that we are expected not to afford the cost of these new solutions. So that's why we think that if we work all together and we collaborate, we share efforts, we can find alternative and innovative ways to face this challenge. And we expect to deliver the outcomes of this pilot solution in 6 months, more or less, even though the research is going to take up to 5 years, because this is something that we have to measure in a long term. But hopefully, we will find altogether new innovative solutions to face the water challenge that is as much important as the carbon footprint one. Moving to policy, this time at health level, I want to speak about the inclusion of environmental criteria in the pharmaceutical strategy. It was along the last year when the new pharmaceutical strategy included for the very first time the sustainability and environmental approach. That meant that sustainability becomes a part of a pharmaceutical value. Now, environmental performance should inform about production, access, and procurement decisions. Specifically, it is spoke about the Profarma. I will address this point later, but pharmaceutical strategy already included that Profarma was going to value the sustainability, social and environmental performance of companies. And that was a very significant step forward in terms of including sustainability at the pharmaceutical strategy. The second one was the draft of medicine law. Even if it is still a draft and it hasn't been approved, it included environmental criteria and sustainability at many levels. In procurement, it was recommended to include the ESG. It was also included the proposal to be a criteria in the price and reimbursement procedure. And it was also included in aspects as, for example, the information that pharmacists manage, how to inform patients not only about the clinical aspect of a product, but also be able to inform about the environmental impact. In sum, the new draft medicines law included as an important part of the development of the legislation sustainability. And what has been already a reality is the sustainability, environmental and social criteria inclusion in the Profarma. It was very promising to us to find that Profarma is scoring to have a sustainability strategy, to have a sustainability committee, to include developmental goals in the sustainability strategies, but also to measure carbon footprint impact, to have the ISO certification and other environmental certification. It was the ISO, the 1004, but it was also the 1047, three many different types of environmental certifications. That is very encouraging to pharmaceutical companies to perform in terms of sustainability, because for the first time, the sustainability is also reinforcing competitiveness for companies. And this is not the only one way to do this. Also, it's been included in public procurement at regional level. Just to give you an example, in Catalonia, they are already included in some tenders the environmental criteria, and they are really putting a lot of efforts in find the proper way and to be pioneer on this public procurement environmental criteria inclusion. It is not easy, and it deserves to be mentioned that they are inviting pharmaceutical companies, pharma industria, but also involving us one by one to better understand how could be the best way to include the environmental and sustainability criteria in public procurement. So this is a very relevant effort, but also that it is not being done in a unilateral way. It is being built in a collaborative manner and cross-sector working. This is, I think, one of the main challenges, okay, to include environmental criteria, not only in public procurement, but also in product evaluations. This is very, very complex, as we must take into consideration not only the whole supply chain impact that comes from the design, manufacturing, but also clinical trials, packaging, distribution, but also use and recycling and elimination. And that involves not only pharmaceutical companies, but the whole health sector. So it requires a very holistic approach to really be able to assess the impact of a product, because it is not necessary to say that when a product reduces hospitalizations, is reducing the main source of carbon footprint. So when it is more important the life cycle, and when is the important the most the impact on health. This is something that is still not standardized, and it's very important to work again together, taking into consideration all sectors and all the agents involved in the health sector and the healthcare system, to do it in a way that really improves the climate change impact, but also keeps not the goal of the health sector, that it improves the quality of life of patients. And this is the reason why Ministry of Health is not only regulating this by legislation, because it's quite complicated. It's a real challenge. So they are developing other tools and other ways to push forward the decarbonization. And just to give a few examples, our national system of health right now has a full commitment with reducing the impact of the national system of health, and it was included already in the strategy for health and environment, what is called in Spain the PESMA. That is a strategy that is shared with the ecological transitions ministry, but they have also another body that has been built together with the Ministry of Ecological Transition, that it's called the Health and Climate Change Observatory, and it has the different perspective from both ministries, and they can work together on this. Another important milestone is the ATACH Alliance, that is the data alliance of countries to reduce the impact of health sector all over the world, that it was held on, I think it was the COP 26. And right now is trying to find common ways to measure the impact of health sector and also common ways to reduce. So they can, in a future, if possible, to be standardized among countries. The first meeting the ATACH has, a face-to-face meeting, took place in Madrid in the Minister of Health, and it was sponsored by the Ministry of Health. And this is also an important way to show our current commitment, no? And it is not only these bodies or institutional working groups, it's also in collaboration with the population and ecologic organizations and society, definitely. And that's why the first carbon footprint measurement for hospital was built with ECODES. There's the Scope CO2 tool. Is a tool that is pushed forward by this Health for the Climate Alliance in Spain, where also pharmaceutical companies, we are involved. It's a whole alliance on this. And ECODES was leader in the first tool to measure the hospital impact. This was a very relevant step because it was a quite easy tool, and so hospitals were able to measure their impact in a simple way. And this was endorsed by the Minister of Health with also seminars, trainings, trying to disseminate and to encourage hospitals to use this tool. Right now, this tool, if I'm not wrong, is getting integrated in a Minister of Health platform that it's called EUCASAN, but that it will be functioning soon. And the initiatives from the system of health are not only in terms of reducing the impact of infrastructures, but also the healthcare. And to do this, they have two priorities that are reducing respiratory care emissions, but also the anesthetic emissions. And it is important because inhalers are one of the sources of CO2 emissions along the healthcare pathway, but it is also important to take this into consideration in a proper manner, always prioritizing the clinical criteria and always prioritizing the health of patients. And that's why this guide of sustainable prescription was launched, and that was built in collaboration also with scientific societies, patients, pharmaceutical companies were also consulted. To us is quite important, innovating to reduce our impact. That's why we have also launched recently our almost net zero next generation propellant. But we always put on the table that first is to have a control patient, not to prevent, to have an optimal care, and definitely then put a focus on the treatment and its carbon footprint. I wanted to also mention a few regional initiatives and legislation. I know that the regional part has been already addressed by the session before, but what I want to show is that the Spain regions are also following this streamline, and they are launching their own healthcare sector impact legislation and initiative. Mainly are plans, no, are plans. So, for example, Galicia is one of the first in implementing these kind of practices with their circular economy in a healthcare model. Indeed, AstraZeneca, we collaborated with the health consortium, health and social consortium in Catalonia to move experts from Catalonia to Galicia to exchange best practices, because both of you are very highly recognized regions in terms of decarbonizing the system. And Galicia is deserves to be mentioned that they have gotten many certification at international level because they work very close to the NHS, and it's one of the main practices that can be mentioned. No? In Canary Islands, it was also one of the first regions in launching the zero emissions and climate resilience plan. They are highly recognized by collaborating with the private sector. Indeed, we have also an agreement with them, and they put focus on renewable energy, sustainable mobility and logistics, hospital decarbonization, but they take into consideration also the idiosyncrasy of an island. No, that's something that it's really different, no, to other regions. And last but not least, I wanted to mention Andalusia, because Andalusia, they strong collaborate with environmental department, because it is not so common, and they have a plan it's called a kind of integral environmental management plan for health sector that is fully contacted with the environmental department, and they support and encourage hospitals to get certificated at regional but also at national level. And this is something we are also collaborating with to support them to assess the hospital impact, reduce, certificate, and then also compensate, because they, in Andalusia, they have their own compensation system that allows the companies to compensate with reforestation and nature-based solution initiatives. I do understand that all of you know that it's a possibility not only to reduce our carbon impact, but in the way we get zero emissions to compensate it by reforesting or recovering biodiversity. And this is something that it is right now in Spain certified by the ministry at national level, but also by a couple of regions. And Andalusia is one of the only regions that collaborates at national, at regional level. So everything is connected, and it must be done just once. Now, moving into the next challenge, that is not only to reduce our impact, but also to adapt our system of health to be ready to support and to provide healthcare to those vulnerable population that are being impacted by climate change. This is because there are vulnerable population that are more impacted by pollution and climate health, but also heat, but also we must think about all the climate disaster as Dana, and how it impacted to the access to health. And we should be resilient and ready to address these new challenges. And to do it, cities and regions must be prepared and to have a proper infrastructures to attend this burden of the climate change. Just to finish, because maybe you have some questions, and I know we are about to end this session in 10 minutes. I wanted to show how we are also supporting and helping to advance. And from AstraZeneca, we are supporting hospitals, but also regions, regional system of health to reduce the environmental impact. How do we do that? We do it by supporting them to assess the environmental impact of health sector. We started by doing this just with hospitals and by promoting and providing resources to hospital to be capable to assess their environmental impact. But we are right now also constructing in collaboration with a global platform that is called the Sustainable Market Initiative, one tool that is also capable to assess the whole patient pathway. So it means that we are working with hospitals to be ready to assess what means diagnosis, what means patient travels, how to assess the staff travel to hospital, how to understand hospitalization or a surgical intervention impact the and so when we have these factor emissions of the different clinical decisions, we can better understand how to reduce our impact, not only by improving infrastructures, but also by an optimal care. Because definitely by an early diagnosis and optimal care, we are reducing the burden. But if we can't go to the detail, it's even easier to understand how to do it. And not only reducing impact, but also getting ready to the adaptation and promoting nature-based solutions, as I mentioned before. And last but not least, to strengthening partnership for sustainability, because as it was already mentioned, it is very important to work with research institutes, public administration, regulation agencies, patient advocacy groups, and civil society to get a proper solution. So right now, we started by measuring, then by including this measuring the pathways, then to do these pilots at regional level, and right now scaling all these initiatives. I think that right now the policies are a very important and powerful motor to push forward decarbonization, but it's not enough. We need also to provide tools to generate incentives and to work all together. And to do it, I think that the initiatives that the precise EU and collaborative platforms are really powerful solutions. So we are more than open to collaborate and to push forward the initiatives. And that's enough from my side, and open to any question.